breathing or...
Hi guys! So I am here live with Jill. It's yoga tune-up though, right?
Yes, at
so
yoga tune-up.
I'm gonna type that in really quickly. She's just blowing up balls here. Hi guys, hello everyone joining. So Jill, let's introduce yourself right now. Oh, what's the pin? There we go.
Well, hi.
Hi.
Jen. This is magical, the magic of Los Angeles.
I know.
We live in two different provinces of Los Angeles. I'm in the valley.
Yeah.
But it's really quick to get over here. I just have to pop over what we call the hill, and I'm in West Hollywood.
I know.
Which is really...
Very convenient, really nice.
It was convenient, good traffic for me. So I am the author of a book called The Role Model, R-O-L-L, and I'm the creator of something called Yoga Tune-Up, and the co-founder of a company called Tune-Up Fitness Worldwide. And my official letters, the letters, if you guys are into letters behind names, I'm what's called a CIAYT, which is a certified yoga therapist. There's a credential for yoga therapist.
God, I didn't even know that.
It just happened in the last year. It's been something that has been in the works for multiple decades, I think 20 or 30 years, to try to figure out what the different credentialing organizations have done in the alternative space, like naturopaths, to elevate the scale of not a yoga teacher, but a yoga therapist. So I have a 1,000-hour credential, and I'm really happy to have a credential.
Yeah.
That right now we're not sure what it means because it's so brand new.
Yeah. So how do you become a yoga therapist, though?
Well, right now I'm in the grandfather stage. So because I've been doing what I've been doing for so long, and I've learned from so many different teachers in and out of the yoga space. I mean, I spent a lot of time in the massage space and the dissection lab, and taking courses that most, I think, yoga teachers weren't taking 20 years ago. And so I amassed a lot of education, a lot of hands-on education, following around my teacher for years, and here I am.
Amazing.
Yeah.
Amazing. And you have created...
Balls. Lots of balls. Yes.
Lots of balls.
Lots of balls. Yeah, that might be something that people are familiar with, is if they've seen my work. A lot of people think that I'm just a ball queen, but I'm more than that.
Of course.
I'm more than just a body by balls. I also have brains, and I also have babies, and those are other things I like to talk about.
Amazing. I love that. But hi guys. So there's a really interesting story though with you, Jill, that you just told me not too long ago, that I think will apply to a lot of people out here too, in terms of, how you kind of got started in this health world, how you even went to finding tools that would help your body, and why. And do you want to speak into some of your health stuff? Sure.
So I think what Jen's talking about is really my call to action to be in the movement space, or the health and wellness space, was I suffered from an eating disorder, and from multiple eating disorders. Actually, we just talked about one of them, but when I was very little, when I was 11 or 12, I was really chubby, and I was 4'10" and weighed just inching up to 100 pounds. And I just stopped eating. I got a lot of flack from my family for being overweight, and I got shamed for being fat. And I took it upon myself to deal with it, and I did it the wrong way. I stopped eating and got incredibly thin. And then I got obsessed and into fitness. My mom brought home the Raquel Welch yoga video. And do you remember that?
Nope. I don't know that one.
It's before your time, for sure. But it's off the shelves because it was actually Bikram's sequence.
Oh, it was?
Yes, that's why nobody hears about it anymore. It was called True Beauty. You can look it up on the internet. If you Google it, you'll see Raquel Welch wearing fatigues and jogging, in the opening credits. And then it's her in this sort of sweaty room.
Oh my God.
With these really hot actors, and they're really hot and sweaty and good looking. doing Bikram sequence. So I learned the Bikram sequence, I don't know, when I was 12 years old from the video, and then also the Jane Fonda workout at the same time. So that was my entry into embodiment.
So someone remembers who that is.
I hope you, yeah, come on. Wasn't it great? Wait, who else has got it? I don't know. She had one. Well, Raquel doesn't have it anymore because Bikram sued her. But people have actually uploaded it to YouTube, so you can just watch it. And I think that because Bikram's empire has fallen apart, I'm not a Bikram person. It's just interesting that for me, this part of the story, that I came to embodiment through media. And I think it's interesting the day that we live in right now that
that's all
so
it
much
is.
But I was this little girl living off the grid in Santa Fe, New Mexico, in a solar home. We didn't have good TV, so we had videos, and that's what brought me into my body and started my journey. And then the anorexia changed in the course of high school, and then I became bulimic, and that was the big way that I was coping with the stresses in my life and with my family.
Yeah.
And eventually I went to college. I was still throwing up, and I confessed to a yoga teacher because school wasn't enough. I had to go off campus and take yoga classes off campus with the money I earned working at Jimmy John's slicing ham. Never forget that job. And I told my yoga teacher that I couldn't feel my abs, and they weren't sore like my roommate. My roommate had sore abs because she was pre-med, and somehow she was not disconnected and disassociated from her anatomy like I was. And I told the teacher, and she told me to lay down on a hamburger bun-shaped beanbag. And this was a prop that they had in the Iyengar studios back in the day, and I think they're actually for headstands. I think, which I wouldn't want to do that either. But it was like soften the blow.
Yeah.
But she told me to lay down on it, on my abdomen, and so I laid face down, and I started to feel not only my abs, but I felt visceral pain. I felt the absolute deep scream of my organs from the stress within them, and also the stress I was putting on them through the bulimia, through the retching. And that was a turning point for me around age 19, and that's how I climbed my way out. And I'm very happy to be alive because anorexia and bulimia are the two deadliest eating disorders, or excuse me, they're the two deadliest addictive diseases for young women. There's more young women that die from those eating disorders than any other cause of death. It's extremely dear to my heart. So the Gorgeous Ball is actually the tool that I use now because it's body friendly, it's skin friendly.
I was using it the other day.
I'm very glad. How did you use it?
I was watching.
Oh, that's right.
Yeah, I was watching a webinar,
a nutrition webinar,
and
you didn't like what they were saying.
I didn't. I gotta say, but I was enjoying rolling. I was using balls, and then I was laying on this while I was just breathing in different areas underneath my rib cage. I use it a lot because my my diaphragm gets a little restricted right underneath my rib cage. And I usually tell people, I say, roll up a yoga mat long ways and then roll it up like a sleeping bag, and you can breathe into that. But this makes it so much easier to not have to do any of that.
Right. And this has more give than the yoga mat.
Oh yeah.
And so and what's kind of beautiful about it is this is your air inside of it as a tool to help you with your air inside of you. So this is your captive air as a treatment tool.
I know. It's amazing. And it felt so good just to be able to do that. So it was like a great webinar because then I got to just lay down on the floor.
And it's super soothing. I mean, if you are a person that has visceral pain, or you have scar tissue on the surface or scar tissue in the deep, this is something that is wonderful for self-scar mobilization, or if you have poor motility. I just read a study today. In fact, I posted it everywhere. It's on my story feed. That a Mayo Clinic, they released a study about gut touch. So they discovered a new mechanotransmitter inside the gut specifically that is the trigger to help serotonin get released. And so it's through touch that the major production site of serotonin in your body isn't your brain, but it's actually your small intestine. So I don't know what this means, but when I lay down, it certainly soothes me. And I know that abdominal massage is one of the many techniques that's recommended for kids on spectrum, for autistic kids, to help them calm down. So there's lots of sort of snuggle effects, good soothing snuggle effects that you can get on a mental health level or a stress level from visceral manipulation or self-visceral massage.
Yeah. And I think people don't realize also how important it is to be, no one massages your stomach, right? When you go to a typical masseuse.
It's illegal in Los Angeles.
What?
Because it's...
Well, I do them all the time.
Well, no, I don't think it's enforced, but it's an old law on the books from prostitution days.
Interesting little nugget there.
Back in the 20s when we were all making moonshine and massaging each other's bellies. But you could do it yourself and not risk the risk.
Yeah,
not risk getting
exactly.
arrested.
Exactly.
I'm going to give you a ticket.
Oh my God, that's hilarious. I mean, I just use it as frontline when you go through the whole body.
Yeah.
When I'm doing my manual techniques. And everyone is, whenever they're a new patient and I get to their belly, they're like, what is happening right now? Mostly it hurts because it's incredibly sensitive when you're not used to that kind of touch on your stomach.
Right.
And most people are often breathing through the chest all day long.
Right.
And rib cage is like super constricted, so there's no movement happening at the rib cage either. So being able to breathe into this throughout the day, I don't think people realize how beneficial it can be. So it's seriously one of the keys, one of the things I recommend to almost every client I have is prone breathing.
Prone breathing, both on the abdomen.
Yes.
Also is safe for some people, and this is what I found just with years of doing this in groups, is that sometimes the abdomen is way too tender.
I know.
There's
especially at first.
so much bracing.
Yes.
And so a softer entry is lying on the waist, right? So it's not as confronting, literally, not as confronting, or side lying on the rib cage. So the ribs, I mean, they're bones, so it's much more protective of the lung sponges within them, and you will have a absolute state change. So an emotional state change, a stress state change, and you'll have a profound breath change, because when you put pressure on the rib bones, you immediately help to improve their upward and downward rotation, meaning that bucket handle effect. And so you simply get rid of the waist better, and you're able to suck air in a more organic way. It's just not as stressful anymore on your system.
Yes, totally. I mean, that's what the easiest way that I say it and that I kind of explain it. It's like if someone scares you and all your tension comes up here, you know, we're automatically turning our state into that high fight, flight, sympathetic state, but then we're also contracting and pulling everything in really tight.
Yep.
And that's where a lot of people live, is in that tightened kind of state. And they're like, how do I increase my mobility? Well,
you don't stand a chance. No, there's no way. So I always start, I'm glad you start with front lying with the cordless ball. I always start with breath mechanics.
Yes, breath is everything.
This is such an easy way to do it, because you get the biofeedback immediately of where you're not breathing or where those referral patterns are for you, right? So if you're a stress breather or a high stress breather, you're going to start to feel a lot of misery in your neck and jaw when the cordless ball goes on you, but there's ways of training you out, because it's a safe way to explore it. Yeah.
That's amazing. And you go through all the techniques in your book.
Yeah, so, well, the role model has many techniques for breathing and many techniques for unlocking the rib cage, and the next book that I'm writing is all of it.
Yeah,
diving
so
much
into
more.
so much more, yeah.
Way more. Yeah, but yes, the role model is head to toe, inside out, coccyx to crown. Yeah.
So then when did you start adding the other tools into your practice and decide that was something that you needed, that you wanted to kind of bring into, because you were teaching yoga.
Yes,
mostly.
I was teaching yoga 100%.
Yeah.
Movement, yoga.
Are you still teaching yoga?
Yeah. So yoga tune-up is a movement-based practice. The role model is the soft tissue self-care. So because people now, I mean, I think even probably my Instagram, there's more pictures of balls than there is of, of movement.
Yeah.
But primarily that's what I started
Yeah.
doing. I was teaching movement, teaching yoga, teaching dance prior to that. And the therapy balls were there's 4 different sizes, but what they were is a proprioception medium. So when you use them, they help to stimulate your body sense. And at the same time that they're stimulating body sense, they also happen to tamp down on pain sensing. They improve your coordination. And what I would find is if I would take a little detour in the middle of class and get people on the balls, if they weren't performing an asana in a way that looked like they were really dialed up, then if they did a little bit of self-massage and then went back into the pose, the rolling had sort of exposed their blind spots and helped to connect that sensory motor linkage, and then they were more comfortable in their skin, they felt more empowered, and they could perform their movements more elegantly and more accurately for their own body, for their structure. So we just started to integrate the role model balls into the classes more and more. And so, if you go to a yoga tune-up class, it's not a ball class. If you go to a role model class, it's balls. But if you go to a yoga tune-up class, you'll have a little bit of balls, a lot of movement, a lot of breath, a lot of mindset, a little bit more balls, and like a layer cake.
Yeah.
But then we'll talk about fascia too. Lots of fascia.
But that's like the most important thing that I think people miss a lot of the times, is that they think this is the tool that's going to fix, rather than actually using the movement and using this as a tool that's going to help facilitate the movement pattern.
Exactly. It's not a Band-Aid.
No.
It's just ball aid.
It's not. You mean it doesn't just stay on me and just connect like a Band-Aid?
Rolls right off.
Right, and that's what. Can you speak into that a little bit more?
Oh, yeah. I wish if I came up with the fix for all human ails, we wouldn't be talking here. We'd be on a yacht in Greece,
exactly.
like, what's up? It's, you are biology.
Yes.
You're biology, but you're this emotional biology. And so we need things that are going to stimulate our ability to heal. And so this is a tool to improve your adaptive response, or to just stimulate your adaptive response. And you are your own best role model. That's why I even did that wordplay for the book title. This is going to give you information, and then you need to do something with that. So I'm not an advocate of loosening yourself and rolling yourself so that you melt into a puddle and disappear. You need to deal with the agonist-antagonist relationships, or synergists gone awry. It's like, this is going to give you information about where your body is locked in a state of holding, or locked in a state of not feeling, which is what, as a hypermobile person, I don't know, are you hypermobile too, Jen?
Actually, no.
No, you're not. Oh, I'm just wondering. I've seen
not so much.
Whenever she does little things, I'm like,
really been that.
Oh yeah, mine doesn't either. So
yay,
that's
good. Don't have that laxity in my body. That's a really quick test that you guys can actually do. Is like, if your thumb is like the hitchhiker thumb that like goes all the way back, it's a really good indication that you have hypermobility and a lot of laxity within your joints and your ligaments.
Like that. Yeah, I like that test. It's a really simple test. It's
very simple test.
Thumbs up and then backwards.
Right, exactly. Might need a little more stability in that body. But you are saying you have hypermobility through your body?
I made myself hypermobile through overstretching. So
which is huge in yoga.
It's huge because we lock into end range and we stay there and we breathe and we we transcend and have these amazing spiritual experiences. And I started doing yoga at age 11, and I was like I've done a million podcasts about this. You can listen to them, and you can listen to my fanaticism or me talking about the fanaticism or the fanatic that I was. My teacher, and I love my teacher. I love him dearly. I've learned so much from him. But we would practice for 8 hours a day.
Oh my, that was longer than I was doing gymnastics a day. What
yoga,
the
body
heck?
work, and massage. Yeah. And so I overstretched easily every single joint in my body. And this was my 20s, my super late teens, and all throughout my 20s. I was very dedicated to the practice and experimented with lots of different tribes of yoga, but I loved lots of them, but the deep, long holds quelled my anxiety. So when I take a look at the sort of my emotional history and my developmental history, the reason I gravitated towards soothing tools is because of very high stress situations, a lot of trauma in my childhood, and this is how I found solace in myself. And so I overdid it. I abused my own body through overstretching, and I work every day at creating strength now.
Wow. And really stabilizing within
that's
the ranges
the whole
that you
concept.
have. Yeah. So because I think this is a really important concept for people to understand, is the idea of overstretching and what it means to really have that passive range of motion, right? Which is what you were stretching into, which means that you're going to be at that end range of motion, breathe, relax, and you can passively get into it. But actively, meaning that now you stand up and you can lift your leg, and how active is that actually carrying over into everyday life?
Like, there's always going to be passive range. It's called accessory motion. So when you lock a part of your body into a wall, a floor, a rope, a pole, you gain accessory motion in a joint. But one of the things that yoga poses, I think, maybe take advantage of, is that accessory motion.
Yeah.
And God, it feels so good. It really does. That's the thing. It feels really good. You get high off of it. And so, okay, I answered, and now I'm like I'm in another place. I'm getting high.
Yoga place.
Yeah, I got in my yoga place. But that's damaging. And one of the things I love about your feed is you have, it's so humbling. Like, the range of motion challenges that you put out there, and I've really enjoyed them, especially my hip flexors, which it's like the splits were the thing that literally destroyed my hip. I actually have a total hip replacement. I had one 10 months ago in my left hip, and rebuilding my understanding of my movement patterns has been extremely humbling.
Wow.
From that point of view.
Wow, interesting.
Yeah. And your feed has been amazing for that, for me.
Well, thank you.
Yeah.
Appreciate that.
She's got a lot of tricks.
But I think that you tapped on it a little bit ago in terms of fascia, which is a hot topic, and a lot of people like to become obsessed with it, and that's why they use this to roll out their fascia and break up the fascia and do all those things, which
I hope not. I hope I'm not trying to break up with your fascia, because it's really important. Like, you don't want to break it up unless you have a legitimate scar. Yeah, anyway, that's just a term I
think we need to be educated on that.
Sure.
So if you would like to, I would love to hear your perspective based on fascia and how are tools and movement combined, because I think that's also a really brilliant thing for people to understand. It's not just going and getting a massage and thinking that that's going to fix you, but it's what that is having an effect on your body so that you can carry that over into movement. So massage, movement together.
Yeah, yes. Massage, movement, and the mind.
And, the mind.
Right?
The mind is here, and then massage and movement with everything else.
So, I was going to bring some books just to show you what I'm reading now.
Do you have the titles?
Anatomy, fascia, big German long names. Yeah, fascia, what it is and why it matters. If you want to get one book on fascia, there's a book that my friend David Lezendak put out just last year. It's called Fascia, What It Is and Why It Matters. And for my money, and I have a lot of fascia books, I think most of them, it is the most readable look, it's not a cartoon, okay? So like that would be really, if it was a cartoon.
Yeah.
But
Then
it's
it'd be
got
really
a
easy.
Yeah, it's got a rock and roll sensibility, and
Good.
it tells you about the history of fascia. When I talk about fascia, I'll talk about it in a few different ways. So one way is to go through the textural layers, and I find that that's an easy way for people to actually connect with what is. Because you're like a strata, you're like a lasagna. You have many layers to yourself. Thank you. So your skin is imminently connected to what is directly underneath it. So if you try to take your skin and pluck it away from something that's underneath it, you'll never do it. You have a really juicy, spongy layer of superficial fascia underneath your skin. That's also known as your fat, right? And your superficial fascia is made up of lots of fat cells. They're quite irregular in their shape, and they're different in thickness all over your body. Like, for example, you know, no one's like, oh, I've got the fattest forehead on the planet, but you've got fat cells lining the underside of your skin here. And then the collagen and elastin matrix and the fluid matrix that makes up the rest of that layer. So if you go to the back of your tricep and feel that fat, it's very different than the fat that's over your sternum. So we have different thicknesses, right? And it's something that we actually need to really respect, because your fatty layer is a lymphoid structure. You've got rivers of hormones running through here. And so when you also have rivers of nerve endings and blood vessels, and so we want to respect them. Like, number one, you want to respect all of you, but if you're just trying to rip and shred and tear and destroy and bruise your fat, think of that as an injury. So that's why I use soft tools for the most part, unless there's a really good reason for me to use a hard tool, because the soft tool respects your soft body. You're this bag of biology, and we want to honor that threshold. Then underneath your superficial fascia, you have another layer of fascia that has many names. So one of the names that just came up into a gigantic news peg in the health world in April was the interstitium. So the interstitium is also known in other circles as loose fascia, or a fascial interface, or a membranous fascia, or also my anatomy mentor Gil Headley calls this perifascial membrane. So this is a fascial sliding zone. And so wherever you find movement in the fatty layer, or at the bottom of the fatty layer, you have the sliding zone, right? I can move my forearm right, left, in and out. I can spin it around. I can pluck it up. So the movement is happening in the deep layer of your superficial fascia at the sliding zone. And that sliding zone is got rivers of hyaluronan, and it's peppered with a specific nerve ending called Ruffini endings. So there's like all kinds of really cool proprioceptors in there that are giving your body sense. And this is all over your body. It's like this inner lake all over your body. So again, we want to respect that. And so when we're working with tools, we want to realize, like, oh, I'm just swimming in it. I'm actually just swimming in the skin, and so I don't want to like go at it with a chainsaw.
Right, exactly.
Or I also want to respect the amount of time I am on a certain spot, because basically I'm blanching, dehydrating, and I could create an ischemic response. I could actually damage my tissue. And then deep to your sliding zone, your loose fascia, you have another layer of deep fascia. And deep fascia does not have the type of loft that your fatty layer has. It looks a little bit like duct tape, and it has an angular appearance. So it also has a wavy appearance, and that wave is inherent to the main fiber within your fascia, which is collagen. And collagen is very curly, and when we think about deep fascia, most people like, all I think about is fascia. I think about other things too, but I think about it a lot. The IT band is a deep fascia structure, but it's also a tendinous structure. So many of our deep fascias overlap with tendons, or aponeuroses, which is another way of saying a flat tendon. And then beneath the deep fascia, it just goes on and on, right?
Yeah.
Your strata, your lasagna, is your myofascia. So the myofascia are your muscles. It's your muscle cells that are encased in multiple layers of fascia. Each muscle cell is wrapped in a layer called the endomysium. Groups of muscle cells are wrapped together in something called the paramysium. Paramysium wrapped in the, in the epimysium. So we have endomysium, paramysium, epimysium, but it's contiguous. So the fascia doesn't just stop and then like another layer starts. Like this is contiguous wrapping and wrapping and wrapping. And so you have the interconnected body. Thank you. I love all the hearts. That was
people are loving this. Just all about fascia.
Off the top of my head, all that coming off about fascia. So we just want to respect that we are this tied together thing. And when we get out of balance from maybe overloading our body too much on one side and not enough on the other side, just Wolf's law applies to fascia just like it applies to bone. So like you'll grow more strength, not only your muscles, but your fascias will also be tighter. So did that satisfy your fascia question?
I hope, did that satisfy your guys's? So, I mean,
hi, Santa Monica
and
Soul.
within all of that, we don't break up. It's not just like one
How do
thing
we loosen
of fascia.
How do we loosen it? Well, why do you want to loosen it, Hannah? Why do you want to loosen it? So we want to mobilize it. I might want to loosen it if I've like overly congested an area. Hi, Shantae. If I've overly congested an area, but I maybe want to just question the question, like what does it mean to loosen it? Like what do you need to do? That's my question to you. It's more philosophical.
But that's the idea, I think, that was getting spread around a lot, and we have these different tools out there. Theragun. That is.
Oh yes.
I'm sorry, I'm gonna name it. Breaking up scar tissue and breaking up fascial adhesions.
Yes.
And I think that's where people get like, okay, I foam roll because I'm gonna go get a deep tissue massage because I'm gonna break up my fascia and I'm gonna loosen things up and then it's gonna be fine because that's fixing me.
Yeah, I think it's not an easy answer in a Insta Live forum, but it's really about restoring the fluid nature within your connective tissues. And so if I've overtrained a certain area, if I've overstrengthened or I've created a lot of rippage from, trying to get my guns busting out, then I'm going to have a lot of stagnation within the fluid exchange in there. And so one of the things that these tools can do is they can bring fluid in to move the detritus out, and that can help to restore the full range of motion within tissues itself, and then that will apply to the joint above and below if I carry through. So in terms of, I understand the loosening because I'm like an overstretcher. So I have to just be like, oh my God, that's a trigger, that word for me. Because I don't want to necessarily loosen.
You don't.
All over. I want to find equanimity, or I want to find efficiency within my structure.
Yes.
And so I have a replaced hip. So I have scar tissue, by the way, that actually needs to get broken up. I have adhesions. Right now they're just superficial. I have just a keloid. I've had myself and other people get their hands to mobilize and find the scar path where that surgeon went to help me mobilize the tissue. I have calcification on a tendon from the surgery, and that, I'll tell you what, a ball and a stretch isn't going to do that. They actually have amazing waveform equipment that can actually get in there and do things.
So it's much deeper.
Yeah, and so that's also another conversation. But
yeah,
what the therapy balls do is, one of the things that they can quickly do is restore the fluid milieu of the area, and then you can train that area correctly so that whatever was damming you up before can't get back there. And so, but that takes repetition. So the reason we roll out the same spot every day is, well, you have to ask, well, how are you chewing? Like, how are you chewing your food? Or how are you leaning in your car? Or how are you sleeping in bed? Like, what are the other 23 and a half hours of the day doing that are conspiring to keep you in this,
that position,
in the ghoul position?
Yep.
And so it's a body conversation that one needs to have respectfully with oneself. And I talk about this at great length in our trainings. And yes, there are ways to, you know, to mobilize things and to restore harmony to an area, but it takes time, and usually it's not a one-shot deal.
Never a one-shot deal. I would go as far as saying never, because I mean, if it took you this long to get locked up into a position, because it's usually not a one-time experience. It's usually a process over time, like she said, leaning one way, always to one side, or whatever hobby, work, whatever you're doing that's happening every single day in a consistent manner. And we think this one thing is going to all of a sudden reverse it all, is just not practicality. So it's actually about the consistency and long-term advantage of being able to add these things into your life and then maintain them on a consistent basis.
Yeah.
I mean, that's what I teach. It's not like go do an hour of mobility once a week. No, but take a few of them every single day and add them into your day. Do one in the morning, do one at work, do one when you're going to work out, and all of a sudden you have a mobility routine, but it got broken up throughout the day, because it's more about the consistent nature of actually repeating this time after time rather than doing it 1 hour a week or 1 hour a month.
There was I think I can address another part of that loosen the thing, because there's somebody else asked about what about knots. And I don't mean to belittle I understand that we're like, I feel tight and I want to loosen something up. Shantae, Movement Maestro, the other day had a great Insta Live, and she was talking about
shortening the tissue, right?
Yeah, you got to find her post, but then she did an Insta Live, and I was in the bathtub and I was commenting to her. Now I can't remember any, but it was so good. And Shantae, I did talk about the interstitium already just now, so like you'll have to watch this back again. Sorry, we could talk about it on the phone. Not everybody wants to hear about the interstitium for like 35 minutes or for 2 hours, but I do. So why is my massage therapist needing to rub out the knots? Well, your connective tissue is responding to your brain, for whatever reason, telling certain fascicles within your muscle to stay tight. And so when your brain is saying, hey, you guys, you shorten up, you got to be in defense mode here, right? So we have like tension in our body we have no idea why. We have these holding patterns. But it's not just the muscle shortening, the fascial tissues, they get pulled into that knot, right? That's typically a neurological response. So the connective tissues are going along for the ride, and then your muscle cell is doing its thing. It's by the way, it's pooing and peeing right there. Do you understand? Like your cells poo and pee.
Explain that a little bit more.
So
I haven't heard that one.
Your cells are living things, and they're excreting things.
Yes.
And so if I'm not getting range of motion in my knot here, because my brain is telling it to stay tight all the time, then I've got cellular excretions, also known as cytokines or cell poo and pee, right? The toilet is stuck right here.
I like how you're saying that.
And so when my massage therapist or my yoga tune-up ball rests on my trap, the first feeling is, it's like this little stingy thing. And then if I breathe, or I can do some tricks like contract, relax, I can start to gain compliance in the myofascia, and then the movement of the ball and the movement of my body can help then to refresh that fluid energy, or that the estuary of that region. So I get these hot spots, these knots that are persistent, not just because my brain is telling me, but I also have this feeling about it because I don't have a good turnover of the waste products that are in that area. So that's why your massage therapist is gonna rub out the knots, and that's kind of what she's rubbing out. And we can call this trigger points or knots or unconscious muscle bracing, and we're just all talking about the same thing. But it's not just thank you. It's not just the muscles that tight, but it's the container. It's the soft tissue container of the muscle that is a part and parcel of the tension.
Right.
And so we need to try to mobilize that tension. And that's when we're loosening things, we're trying to get that going.
But I think what you said in the very beginning is also very important for people to understand. you're saying when someone is first touching that area that feels like a knot or a lot of tension, the tendency is to like gasp, right? And go even tighter in there.
Sure.
But you address something that is breathing
Yes.
into it and relaxing, because I don't think you're not going to have the same efficiency, is what we're talking about, and effect if you're going to stay locked up. So if someone's just rubbing into something and all you're doing is getting tenser and tenser and tenser, your brain is not going to be able to connect, which is that first response. Any kind of touch is that first proprioceptive response. Right. So we're not even going to be able to get that same effect and that
the therapeutic effect.
Right, exactly. That we really want to create by having the gliding and the sliding and things to start to work and pee and poo better.
Thank you. Thank you.
I really liked it. Okay, I really liked it.
It's my favorite
analogy. It's not gonna do
I'm a mom.
as well if you're not actually breathing and relaxing into these responses. So you get to determine how deep you're going to go based on what you can initially tolerate.
Yeah. And that's one of the reasons why this for me is the first tool, because if I can help somebody let down their own guard, right? And this ball helps to up-regulate your down-regulation. It helps to what I call turn on your off switch. So if I can turn on my off switch and I can create a more hospitable environment, if I can be a better host to my own self-therapy, then I've already taken care of all this body armor, and then I can actually get to work. I can get to the stuff. And then there's other tricks that we use. In the role model, we have 9 different techniques that we use that you can use to experiment with different structures to help improve, your improve your connection to your structures or to whatever body part is ailing you. Yeah, that's
perfect.
Totes.
Totally. Yeah. And I think it's just really important for people to start to understand where these tools come into play, why we're adding them into our lives, why you go get a massage, but why you also add in movement and activity, and that's yoga tune-up.
Yep.
Right? It's not just about these. I mean, by the way, I've been using this the entire live on my...
Have you been sitting on it?
No, I've been using it all. Like, you haven't seen my leg going back and forth this entire time.
I noticed you're scooting a little towards the treadmill. I was wondering if you're warming up for the ride or
no. I've been using this entire time, and it feels amazing. This is the alpha ball.
The alpha ball. It's the big boy ball.
It's the big one.
Big body parts, and yeah, they come in a twin set also. You can get one, or you can get the alpha twins.
It's amazing though. I mean, these are all incredible, and I appreciate you. So I want to answer just a couple questions if you guys have questions, because I have to go. Thank you. Can you also mention foam rolling? Doesn't it loosen up?
So foam rolling is another, what I would say, a stimulant, and it's broad.
Yes.
So because it's broad, it's not going to be able to do the type of detail work that these balls do. And it depends on actually the texture of your foam roller. I love Stu Hitzman's foam roller, the melt method, because it's gushy and it's got a lot of give. So it's very kind to bony prominences. All of the role model balls are squishy, and so they conform to your form. When they roll around bony prominences, they don't annoy, pinch, or bruise as harder balls do, or a foam roller cannot even approximate each individual spinal joint. We made the yoga tune-up balls this size so that they can actually manage one vertebra at a time. They're also great for your feet. They're great for your face. The Therapy Ball Plus is just a little bit larger. It's a little larger than a lacrosse ball. And then the Alpha, if I can get Jen to give it to me, is just a little larger than that. It's a little bit smaller than a softball. But all of them have a durometer that the rubber has squish to it, and the more they're used, the squishier they get. And the other cool thing is that all of the balls are intensely grippy. And that grip takes a hold, guess what, of your skin and the superficial fascia. And so I'm able to really manipulate that interstitium. I'm able to manipulate my sliding zone. And then the Gorgeous Ball is the same. It's an incredibly tender skin, and it's super grippy. And so what we say is this approximates the type of pressure of a palm, and then the Alpha is like a fist, the Plus is like an elbow, and then the Yoga Tune-Up Ball is a thumb. Not one that goes backwards, though.
Yeah.
You're never going to damage your thumbs.
I know, because it doesn't go back as far. Well, thank you.
Thank you.
That was amazing.
Really
Do you guys
fun.
have any last minute questions before we hop off here? I think something went too close to the knee. Felt pain for a day.
Yeah, I mean, look, any tool, any massage tool you use is a micro stretcher. And so can you overdo rolling? Yes. Just because it's therapeutic doesn't mean that what did she say? Thank you for sharing your brain's friend's interstitium. All right, girl, I'm going to save all my interstitium stuff for you. How's that?
I love it. I love it. Collagen supplements.
I don't know. Not a nutritionist.
Yeah,
you got to ask my nutrition
I
friend.
would just say don't overdo it. So just because you find out that something is good for you doesn't mean that you put it in everything, because then we're overdoing anything. Everything in moderation. That's my go-to. But again, I'm going to say
I'm just going to say chocolate. I'll just say chocolate. So I just don't ask me about supplements. I'm terrible with that. Chocolate. That's my supplement.
Yes. All right, guys.
Collagen.
We're going to hop off, but you can...
We're going to roll off.
We're going to roll off. You can always, I pinned her handle right here, so you can screenshot it and go back to it if you forget it, okay? Or you can screenshot us and drop us in your stories, because, say how much you learned from us.
That was fun.
That was fun. That was amazing. Thank you for bringing your brain and your knowledge and educating everyone. This is why I love being able to have this platform, is just to get people like you on here and educate. So thank you.
Thank you, Jen.
That was amazing. Yay. All right, guys. Rolling with my homies. Thanks, ladies. Bye, guys. And if you missed any of it, go back, watch whatever you missed, because there's some golden nuggets in there.